Hi, my name's Emily Erickson, and I'm going to show you how to clean a tracheostomy tube. So first I'm going to show you the supplies that you're going to need to do this. The first thing is a tracheostomy care kit, and this includes the tray, a tracheostomy brush, the dressing, pipe cleaners, a drape, and then some gauze sponges, as well as gloves, but I don't use the gloves that are in here, I just use different ones. You also need a trach tie that you're going to change that's on the patient's neck. You'll need sterile water, and then hydrogen peroxide, and then of course you'll need some hand sanitizer and then gloves. So first, what you're going to do is set up your tracheostomy tray. So what you're going to do is, I don't put on gloves yet because I'm not going to touch anything in there. I'm just going to pull the opening open. So you pull this open like this, and then you're going to take out the drape that's inside, and you're just going to open this like this and lay it on your table, and then you lay it out on your tray like this, and then you're going to dump the supplies onto that thing. And then you see how there's two different things. The hydrogen peroxide goes in this one, and then the sterile water goes in this one. So you're going to open this, and then pour it into the container. And then you're going to open your hydrogen peroxide. And then also pour that in there. And then this is the time where you're going to put on your gloves. And then you put on your gloves. So then you're going to come over to the patient, and then you are going to I'm going to hold it so I can show you a little bit better. So then you're going to take off these trach ties, which is like this, and then you just slowly pull it out, and then you'll throw this dirty one away. And then with the trach, this is the dirty one. So with this type of trach, you can take this one completely out like this, and then you throw the dirty one into the sterile water just like this. And so once it's in there, you're going to take this little thing like this, the pipe cleaner, sorry, and then you're just gonna go in and out of the tube just like this to make sure all of the secretions and everything else is out of it. And you just kind of do that a couple times. And the peroxide, and it is normal for it to be bubbly from the peroxide. So you just clean it in and out just like this. And then I also go around the top just to make sure if that's dirty or anything like that. So that you'll throw this away, and then since now that's clean, you want to take off your dirty gloves, hand sanitizer, and put on a fresh pair of gloves to dry it off, because you're going to put it back into the patient. So you don't want to use the dirty gloves that you cleaned it with to put them back in the So now that it's clean, you can take these gauze, make sure it's dried. Then you can also use these little pipe cleaners, and you could put them on the inside of it, and so it gets the inside all cleaned out and dry. And then they also have Q-tips, so if you can't reach like the inside of here, you can kind of clean that. Okay, so now that that's all clean, we're able to put it back into the patient. So this is how it is. You don't want to put it in this way. You want to make sure that the tube is down. And then again, so you can see, put it in. So you're going to take it and then you just put it straight down in there, just like that. And then, sorry about that. And then now we can put the new trach tie in. So you open it just like this. And then it has the writing on it. So that's gonna go on the back of the neck. So this will face, the writing will face on the back. And then it kind of just has two little things. So I'm gonna put one side on and then so it just loops through like this. And then you'll put it, lift up the patient's head gently. And then the other side unclips as well. And then you just place it back on just like this. Now I'm gonna take off these gloves and then I'll show you what it looks like when the new trach tie's on, and you just wanna make sure that you can put 2 finger licks in there so it's not too tight. And then just make sure that you kind of wipe around the patient's stoma area if it's dirty or has secretions on it. Also, if you need to, if the patient is really has a lot of secretions coming out, you can suction the patient. There's not a suctioning machine in this room, but you would just stick it down in that tube and then you would suction them out so they can breathe better. But that is my demonstration speech on how to properly clean a tracheostomy on a patient. And then once you're done with all your supplies, you throw them in the trash can and you're done. Thank you.